Hi, this is Kristen Astorga, and so I'm going to be answering a few questions for my college class for 3321 Patient Provider Communication. The subject is prescription awareness and regards to the opioid epidemic. For number one, for information, what information was easiest for you to discern? The easiest information for me to discern was the state of mind of the people that were addicted to the opioids. One person says the doctor prescribed them, so it should not be bad. When thinking about this, when a doctor prescribes you a medication, you should think, well, it's not going to harm me because my doctor would not prescribe it to me. As compared to getting drugs off the street. You don't know who made it. You don't know where it comes from. And if you do, then you know that there's a lot of harmful chemicals and reactions when you take those type of drugs compared to a doctor prescribing you something for an illness or disease. That's a part of the patient-doctor relationship that we read about when you need to establish trust and also be self-advocate. Trust, you need to have trust in healthcare, especially with a doctor. If not, then a patient will not be able to continue to see that doctor and might not think of healthcare as important or that helps them. Something as simple as a prescription. A doctor prescribes these medications to you to fix your problem, they're not supposed to create another problem. And for self-advocates. So a patient being self-advocate is well educated in the type of care and the type of outcomes needed in their treatment. And so that's when the patient can become self-advocate. Also, a sense of control. We would like a sense of control where patients are well informed, actively involved. It is said in the reading that only 20% want caregivers to make decisions without them. So that goes in regards to like holistic care. Patients and doctors should collaborate to have a combined treatment plan. Okay, for number two, it says, was the organization of the information easy for you to navigate and explain? The CDC does a good job of applying the patient perspective as far as having people's stories in the video and also in the link for awareness. It's relatable because these are people stories. It seems like it could be you and it could be a family member. Also in the link for awareness, it states the goals of the campaign, where it's increase awareness that opioids can be addictive and dangerous, and increase the number of individuals who avoid using opioids non-medically, recreationally, or who choose options other than the opioids for safe and effective pain management. Just the fact that it tells the real life stories of these people who struggle with opioid addiction and also show their why the CDC wants to bring awareness. Also, I like this that it provides the stats. Let's see, we have 183,000 died in the US from 1999 to 2015. And then it states 1,000 are treated in the ER every day. So I thought that was very well organized as far as providing that type of information to anybody who wants that information or needs that information. Number 3, it says, which of the real stories is the most memorable or meaningful to you and why? Oh, the one that was most meaningful to me was Britain. He was a military man that was in, uh, it looked like, well, he was in the military. So first of all, I'm thinking, he's strong, he's structured. I would never think somebody from that perspective in that atmosphere would ever be able to be addicted to a medication prescribed by a doctor. But his story kind of brings red flags, like it it could and can be anybody in your life, in your family, or you yourself. And so that concludes my this concludes my questions. I also wanted to know a little bit more about this, and then as far as, because I didn't know what all the opioids were, I've heard of some, and so I want to list those for you. Heroin, which actually actually blows my mind because that is not a prescription drug from a doctor. So that's a drug you can get off the streets and become addicted to. So for any of these other medications just to be in the same category as them blew my mind. Opium is another one, oxycodone, hydrocodone, morphine, hydromorphine, fentanyl, codeine, oxymorphone, and tramadol. Excuse my mispronunciation, but some of these medications I've actually taken on my own. And just to know that they could be highly addictive is scary. I hope I hope all my answers were clear, and thank you for listening, and um, thank you. This concludes my video diary 2 assignment.